Hello and welcome. My name is Jessie Poon and I'm Chair of Regional Studies Association. I'm delighted to be here on behalf of the Board of RSA to give our Media Communications in Regional Studies Award. This award is a recognition of the best media communications across the regional field and science and its importance to showcase research and data widely. Previous winners include Coffee Break with Researchers, Politico Europe, For the Brexit Files, the Committee of the Regions, and especially the work of Wolfgang Petzold in Belgium, and the Institute for Public Policy Research in UK. The 2021 winner has continually provided us with updated COVID-19 data and expert guidance, including cases and hospitalizations, as well as testing, contact tracing, and vaccine efforts to help the public, policymakers, and healthcare professionals worldwide respond to the pandemic. The nomination was unanimously supported by members of the RSA board. I'm very happy to announce the 2021 winning project, the Johns Hopkins Coronavirus Resource Center, or CRC, which is an interdisciplinary effort between several groups at Johns Hopkins, including the Bloomberg School of Public Health, Applied Physics Lab, Center for Systems Science and Engineering, and the Centers for Civic Impact. Since the pandemic began, experts at Johns Hopkins have been collecting and analyzing domestic and international data about COVID-19. The effort began on January 22nd in 2020 with one of the first global maps to track COVID-19 cases and deaths. By the 3rd of March 2020, it had evolved into the Johns Hopkins Coronavirus Resource Center, using more than 260 sources, including 182 from local, state, and federal agencies in the United States. And now I'd like to welcome the CRC experts. Dr. Lainey Radkal, CRC Project Lead, is a professor of health policy and management and senior advisor to President Ronald Daniels. Beth Blauer, CRC Data Lead, is executive director of the Centers for Civic Impact at Johns Hopkins. Dr. Jennifer Nuzzo, CRC Epidemiology Lead, is an associate professor in the Department of Epidemiology and the Department of Environmental Health and Engineering. She is a senior scholar at the Johns Hopkins Center for Health Security. Congratulations. Thank you for being here. And I'd like to pass this over to Lainey.
Thank you so much, Jessie. On behalf of the entire Johns Hopkins Coronavirus Resource Center team, we are absolutely thrilled to receive the Regional Studies Association 2021 Media Communications Award. Shortly after Dr. Lauren Gardner developed the COVID-19 Global Dashboard in January of 2020, we witnessed the public's hunger for sound data and reliable information from a trusted source. As the threat from COVID-19 spread, Johns Hopkins President Ron Daniels tasked us with expanding the global dashboard into what is today the Johns Hopkins Coronavirus Resource Center. And we built a team that would harness expertise from across Johns Hopkins University and medicine. We think that this interdisciplinary effort embodies the role that universities like Johns Hopkins play in advancing discovery, informing evidence-based policymaking, and sharing facts and research with the world. For us, with the Coronavirus Resource Center, we have truly been able to put our university's mission, knowledge for the world, into practice. Beth, would you like to add anything?
Thanks, Lainey. I'd also like to thank the Regional Studies Association for this wonderful recognition. I serve as the data lead for the Coronavirus Resource Center, and I spent my career focused on democratizing data. To me, this means making data easy to access and interpret. Along with my team at the Johns Hopkins Centers for Civic Impact, I've worked for years to develop data visualizations for governments throughout the world. At the Coronavirus Resource Center, we think of ourselves as having three key audiences who are interested in data, policymakers, media, and the public. We have routine engagement with all of these groups, and we carefully consider each audience when we're developing materials for the site. We've learned many lessons, especially about the need for standards related to data collection, reporting, and access. This pandemic has fundamentally changed the public's relationship with data, and we hope that our work will help inform preparedness for future pandemics and inform strategies to reform public health. Jennifer, would you like to add anything?
Thanks, Beth. I'll join my colleagues in thanking the Regional Studies Association for recognizing the Coronavirus Resource Center with this incredible award. I've considered it to be a great privilege to serve as the site's lead epidemiologist, in part because I also consider myself to be a user of the site. And one of the things I value most is our ability to interpret and translate data for multiple groups. Our experts, including myself, have spent a lot of time engaging with the media to ensure that the public has access to timely and accurate data and our analysis of COVID trends. So for instance, we offer every Friday a 30-minute briefing over the web that comes from the staff of the Coronavirus Resource Center, and members of our team answer questions in real time. This has been really rewarding, and we see this as a key opportunity to engage with our audience. With the Coronavirus Resource Center, we've seen that universities can and should play key roles during global emergencies. At a time when public distrust of government is high, universities serve as an independent and credible voice. And we should continue to bring our experts together and tackle today's most pressing challenges. So thank you, and back to you, Jessie.
My warmest congratulations to you again. It's really nice to meet you. On behalf of the RSA board, I would like to thank you for providing us with information and data on public health, infectious disease, and emergency preparedness of the international response to COVID-19. Thank you for joining us virtually today. Goodbye.